You're watching CTOM TV. Knowledge is power.
So getting the essentials without getting COVID-19. Dr. Jeffrey Van Wingen, maybe you've heard of him, maybe you haven't. He's from the United States, and for some time he's had a YouTube channel talking about a variety of different things. But with the COVID-19 pandemic, he's made a wonderful video about how to handle shopping and takeout to reduce your spread of COVID-19 using sterile technique like they would in the hospital. Here's the link for it. I'll actually take you to his YouTube site in just a minute. But I want to run through the basic guidelines. It's really valuable information for you. Generally, the understanding is, wherever possible, if you microwave your food just a little bit, it shows that microwaving can make a big difference to whether any COVID virus is actually in your food that you're about to ingest or on your plate. It's important to note, freezing does not have the same effect. In fact, other strains of coronavirus have been shown to live in your freezer for up to 2 years. 2 years. So if you're thinking, oh, I'm bringing my frozen stuff home from the grocery store and I'm just going to put it straight into the freezer, I won't touch it for a few days, that'll be fine. Actually, not so much, apparently. The virus can live in the freezer for up to 2 years. So we have other plans for that. But let's talk about shopping services and delivery services for starters. So I've mentioned FedEx coming to your home, maybe to bring one of our test kits or return it to us. Where also lots of folks are ordering shopping services or takeout. We'll talk more about takeout in a few minutes. Ideally, if you're going to use a shopping service, fundamental do's and don'ts, don't have that person come into your home. Have them leave the things outside. Don't allow them to come into your home and perhaps bring the COVID virus with them, or perhaps get it from you. You might be one of those asymptomatic people. Have them leave the groceries on the porch or outside. Latest data says coronavirus can live aerosolized. So let's say I have coronavirus and I cough and it lands somewhere on my laptop. It can live right around there for about 3 hours. So anybody that were to come into my office and touch my laptop in that 3-hour period of time could very well contract COVID-19. Now, this is especially relevant for you if you're thinking about going to the grocery store. You might think, hey, I'm the only person in this aisle, it's all good. Well, we don't know who was in that aisle before and whether they happened accidentally to cough a little or sneeze a little while they were holding this thing that you're now about to put into your cart. Coronavirus can live on cardboard for 1 hour. So think pizza delivery. 1 hour can be on that cardboard. And it can live on metal and plastic for 3 days. So again, kind of think about things you're bringing into the home, like canned goods, or maybe a bag of trail mix and things like that. Coronavirus can live on those products for 3 days. So Dr. Jeffrey Wingen suggests that if possible, leave those groceries on the porch or in the garage for 3 days. That's not necessarily possible for everybody based on where you live or the type of grocery that you're bringing in. So don't worry about it. We've got a plan for that. But if possible, leave those things outside if you can for 3 days. While you're shopping, start out with some Lysol wipes or some good antiseptic spray. Wipe down the cart handles or anywhere that you're likely to touch the cart with those wipes. You want to assume that whoever was there before you had COVID-19, and maybe their kid was in the cart and they also had COVID-19 and they touched everything. Let's presume that. Don't worry about seeming like you're overreacting. It's really important to be seen like you're overreacting right now. It's the appropriate time to do that, and therefore not an overreaction. So wipe down those cart handles. Ideally also, Dr. Van Wingen says, commit to buying before you touch anything. In other words, you know how we might wander through the aisles on a normal day. We might pick something up, look at the ingredients, decide if that's what we want. This is not the time for that. This is the time to get in and out as quickly as you possibly can. Absolutely. Keep that distance, that llama distance between you and the other person. And before you pick anything up off the shelf, make sure it's on your list or something that you want. So kind of touch it once, put it in the cart, end of story. If you have any respiratory symptoms at all, for the sake of the people out there, don't go shopping. Have someone pick some stuff up for you. Really just avoid these public spaces. And ideally, no one over the age of 60 should be going out and doing these things right now. I understand that there's best practices and then there's reality for some of you. Some of you won't have someone who can do these things for you, in which case it's even more important that you follow these things we've talked about preparing to go, about how to handle being at the store, and what we're about to talk about what you do when you get your groceries home. As much as there's this talk of hoarders, and we don't want to be one of those, the rule of thumb is to try to get 2 weeks of groceries when you go. So you don't have to go again for 2 weeks. Plan what you buy ahead so you can really minimize your time in the store. Again, we're not going to be looking around and wandering around like you might on a normal shopping trip, at least like I might on a normal shopping trip, maybe not you. If you can, call ahead and have the things that you know you want prepared for you. Grocery stores are quite inundated right now, but if you're patient, you can probably get through and they'll do this for you. Everything's just going to take a little bit longer, and we need to accept that that's the reality right now. Pet stores and pharmacies will happily prepare an order for you. So those are 2 stops that you might have to make in addition to the grocery store that you can really make a lot shorter and minimize your exposure. Dr. Jeffrey Van Wingen talks about when you get your groceries home, you follow sterile technique protocol. And his video, he walks you right through it. Again, I'll take you to that site and show you the link. But I'm just going to walk through the steps that he talks about. Before you bring your groceries in and put them anywhere, so there you leave them in the car or maybe put them on the front porch depending on your circumstance, what you should be doing is clearing your countertop. I know not everybody has a lot of counter space, but clearing as much space as you can, and you separate your countertop into 2 sections. The section that the groceries that just came in from outside are going to go on, and the section that the cleaned, sanitized groceries are going to go on. In his video, he's got a piece of tape down the middle. I don't know that you need to do that, but it could hurt from, or could not hurt from a visual perspective. But I think he's just really wanting to accentuate that there's 2 separate sides and never the twain shall meet. So you split the counter into half, put new groceries on the one side, and that's the only space in the home they touch. So they stay outside until that space is ready to rock and roll. Then you bring them in, pop them down there. That's the only place those bags from the grocery store are going to be touching. What he then suggests you do is actively disinfect the outside of all packaging. You can use a spray depending on the type of packaging. Of course, cardboard you might not want to spray. Plastic, metal, of course you can. But you want to either use a wipe or you want to use some spray and disinfect the outside of the packaging. Let's say you've got a cereal box. You take the inside plastic packaging out of the cereal box and put that on your sterilized side, and the cereal box itself, which was exposed to other people at the store, goes directly into your garbage, which we'll talk about in a minute. Use alternative storage containers as much as you can. So when you bring a loaf of bread in, for example, rather than wiping off the outside of the loaf of bread, preferably dump all the bread into a Tupperware container or another bag or container, and then take the bag that you brought in from outside and put that in the garbage as well. He recommends that fruits and vegetables that can be washed, like apples and oranges, that you actually put them into fresh soapy water. and you let them soak for a few minutes, and then you wash each piece of fruit, just like those 20 seconds that you would do with your hands. You're going to do that with your fruits and veg too, just to make sure that there's no coronavirus on these things. Is in the same way, if you think about it, that the virus can live in your freezer for up to 2 years, your fridge is a less hostile environment. So don't be thinking that because it's in the fridge, it's dead. It's not like a little fly that you brought in from the vegetable garden. It's something far more dangerous. If you use cloth bags for your shopping, which of course we've all, well, probably most of us anyway, started to do, and it's a wonderful thing to do for the environment. But if you do, you should assume that they've somehow got some of the COVID-19 on them. You should put them outside for at least 3 days after you've used them, and then throw them in the washing machine. We are trying to be so environmentally conscious as a species, I think. So it might feel really bad or wrong to use plastic bags, or perhaps your supermarket has actually already gone the way of not offering plastic bags. So cloth bags might be all you have to use. But again, if you're getting 2 weeks of groceries or about that, those bags can go outside or on your deck for 3 days without any consequence to you. And that way, if there is any COVID-19 on those bags, somehow it won't affect you. Now we'll talk about takeout. It's kind of the same thing as we just went through with bringing your groceries in. You want to make sure the delivery person does not come in. You don't want to be touching anything that they're touching and vice versa. You want to sanitize your countertop. You want to separate the counter space with the stuff that just came in from outside and maybe the plate or whatever it is you're going to be putting your food on. In other words, you're not going to eat from those takeout containers. If there's sauces like ketchup packs, you squeeze those onto the plate, and the packaging of those packs go back into the takeout containers to be put into the garbage and immediately disposed of outside. Once you're done bringing the takeout in and putting it onto the plate, you're going to wash your hands really well again with lots of soap for at least 20 seconds. And then you'll know you've done everything you can to prevent bringing COVID-19 into your home. And you can just relax and enjoy your meal. You won't have that little hamster on the wheel in the back of your head wondering if perhaps that you're getting COVID right now. So follow those best practices, and that'll help. Let's actually just go right now and look at Dr. Van Wingen's YouTube video.
I'm a family physician practicing in Grand Rapids, Michigan with 20 years experience. The point of this video is to help you shop safer and get takeout food safer during the stay-at-home shutdown due to the coronavirus pandemic.
Okay, so we're not going to watch the whole thing, but that's Dr. Jeffrey Van Wingen. I highly encourage you to visit that link and just watch that video. He walks you through the whole process. It's very handy.
Thank you for watching Seatome TV. Subscribe below and stay informed.